Good morning. My name is Marissa Lennox, and I'm the Chief Policy Officer here at CARP. Thank you all so much for coming and for braving this weather today. Healthcare in Canada is not just broken. It is systemically corrupted. Our dollars are spent inefficiently. Stakeholders from hospitals to primary care providers to long-term care facilities function in silos, and our system is ill-designed to meet the needs of patients today. This is not for lack of dollars. Canada is one of the largest spenders on healthcare. Last year, we spent 10.7% of our GDP on health, which placed us 6th highest among OECD countries with comparable healthcare systems. That is a total of $264 billion, or more than $7,000 per person in Canada. Yet the health outcomes we receive are by any measure mediocre to abysmal when compared to that of other high-income countries with comparable systems. For example, Canadians wait longer for specialist appointments and elective surgeries than patients in Netherlands, Switzerland, Germany, and Australia. Why is that? In Scotland, over 90% of patients see their GP in 48 hours. In Canada, only 43% of patients do. Why is that? And on weekends, forget about it. You can't get an appointment. And when it comes to wait times in the emergency department, Canada ranks among the worst in the developed world. But statistics only tell the hard, measurable facts about how our system is doing. It does not tell the stories of anguish, pain, suffering, and dehumanizing experiences by Canadians who are let down by this system every day. I hear from CARP members every day wanting to share their stories, their horrific stories with the healthcare system. As an example, one woman placed in a hospital room with a dead body for nearly 24 hours. Another forced to sit on a stretcher in a hallway all night, soaked in urine. We read stories in the media of seniors dying in long-term care from preventable infections like UTIs, or homes serving 6-month expired liquid eggs to its residents. The status quo has never been acceptable, but going forward, it cannot be tolerated. In yesterday's news, a patient with dementia was placed in a solitary confinement in a cement-blocked room with nothing more than a gurney and her food served to her on a tray on the floor, as one would expect in a prison. And the hospital's only response, an apology. Was anyone fired? No. Were there any consequences for this? Absolutely not. Even worse, it could happen again. These stories should make you angry. They make me angry. This is our healthcare system. We are all shareholders. Shouldn't we demand better? The current landscape is such that our long-term care beds are full, and often in the wrong locations. Home care hours are limited. Patients are kept in hospital, even when they no longer need to be there because there's nowhere else for them to go. What's worse, some provinces charge the patient for being there when no longer requiring care as if it's their fault. And we wonder why wait times for surgeries are so long. Surgeons can't get operating room time due to a lack of recovery beds. The ripple effect through the system is endless. Too many apologists for the current state of the Canadian healthcare system only look to the US as an example of what is worse. And when we speak to people about our healthcare system, we're often directed to the US because we think our system is better, right? But when you look at other countries like Denmark, the Netherlands, Norway, Japan, Australia, these countries are spending less and getting more, and are all examples of systems that have embraced innovation and modernization, and Canada has so much to learn. For one, they actually provide public coverage for more services and products than we do. Canada is the only national healthcare system in the OECD that doesn't have a national drug plan. Drug coverage in Canada is more similar to that in the US, with challenges of access, affordability, and even different rules to receive coverage for the same drug in many cases. No wonder we have so many gaps in care in Canada. Cancer treatments are a powerful example of how inequitable access exists in Canada. In the 4 Western provinces, access to cancer treatments are publicly covered, irrespective of whether it is for a drug treatment, radiation treatment, or surgery. Here in Ontario, by contrast, the surgery and radiation are publicly covered, but drug coverage is all over the map. If you are a senior or on a provincial social assistance program, your cancer drug, be it a pill or an infusion, is publicly funded. But if you are not an ODB beneficiary, you are expected to pay for your cancer drug if it is a pill. If it is a transfusion, the government pays. How does that make any sense? In the Atlantic, it's worse. In PEI, you'd be lucky to have any cancer drug publicly covered. So if you're diagnosed with a life-altering disease like cancer, it really makes you think about where you want to live in this country. And we have heard those stories too. Long-term care is another area of our healthcare system failing Canadians. It is plagued by chronic staff shortages, inadequate training, and a lack of beds. Wait lists can span years, and for those for whom long-term care is medically necessary, they are often left waiting in hospitals or without sufficient supports. And isn't it odd that the individuals who provide the most direct contact care, personal support workers and care workers, are paid the least? Shouldn't we invest in our care workers, the people that are caring for the most vulnerable members of our society? And then there's home care. In the case of Denmark, they saw that their population was aging 20 years ago and made critical investments in home and community care to meet the needs of an aging population. Our governments saw this trend too, but they failed to course correct. And the consequence of this is inefficiencies in our system, wasted dollars, wasted time, and ultimately poorer outcomes. Other countries do a much better job of this. For example, in the Netherlands, when a patient either needs long-term care or home care, the patient has a place to go. If for some reason the patient is ready for discharge, but the facility is not able to receive them, then that facility is charged a fee by the hospital until the patient is received. As well, if the facility is ready to receive the discharged patient, but the hospital is not ready for discharge, then the hospital is charged a rate until the patient is discharged. Even in publicly funded systems, the power of economic incentives can and do work. And all of this, and we haven't even addressed the challenges in accessing a doctor. 62% of physician practices are no longer accepting patients in Canada. Canadians who self-report they have a family physician is similar to other major comparable countries, but having a family physician does not mean you have good access to them. For example, only 22% of Canadian physicians provide the option to their patients to communicate with them either by email or by a secure website. By comparison, 91% in Sweden do. Only 21% of physicians offer the option to book an appointment online in Canada, versus in the UK, 90% do. To request a prescription refill, only 9% of Canadian physicians offer this service online, versus 94% in Sweden. For patients wanting to view a summary of their physician visit, only 5% of Canadian patients do so, versus Canadian physicians do so, versus 87% in Sweden. As well, less than half of Canadian physicians have arrangements for a patient to be seen when the office is closed. In Germany, 92% do. And did you realize that only 36% of Canadian physicians feel well prepared to manage a palliative care patient? In the Netherlands, 97% feel well prepared. It is clear that the problem is not money. We have a fractured healthcare system that is not really a healthcare system at all. Rather, it is a collection of funds that pay for specific things, like seeing a doctor, or having an operation, or having a diagnostic or laboratory test. However, those who can access those, it's often based on your age, your income, your health condition, your disability, and where you live. It is 2020, and there has never been more powerful and cost-effective ways to communicate with patients or healthcare providers, and yet the fax machine remains the communication tool of choice if physicians are involved. This is not acceptable. While governments and health professionals continue to debate and negotiate what is supposedly good for us, when and where we can get it and by whom, patients wait and suffer. If the $264 billion we collectively spent on healthcare in Canada last year was an investment fund, we would fire the fund managers for poor performance and for providing what we as shareholders want and therefore invested to achieve. As shareholders, we need to stand up and we need to demand that the health system does what it's supposed to do, not what government decrees. As such, Canada has sent a letter to all 14 First Ministers as the leaders of this country to convene an emergency meeting to reset the direction of our healthcare system so that Canada is in the top 5 countries for healthcare system performance and that we achieve this before their next election. It is time that we demand better. Our federal and provincial leaders must fix this healthcare system now, and now is the time for change. This is an important, perhaps the most important campaign in CARP's history. As the trusted voice for over 320,000 Canadians, CARP will make sure that your voice is loud and clear. If you've joined us today in person or online and you have a story to share about your experience with the healthcare system, we encourage you to get in contact with one of us today. Thank you. Now I'd like to call up my colleague and friend, David Cravit. He's a member of the board of directors for CARP. He's also CARP's chief marketing officer.
Thank you, Marissa. Good morning, everyone. Good morning to everyone online. I'm going to introduce you to some of the communications elements, ads, commercials, and so on that we're going to be running this year, because it's not enough to talk to ourselves. We have to spread the message to other Canadians across the country. And the strategy here is very simple: to get everybody mad. We have to get mad. It's in our power. We represent, you realize we represent 62% of all ballots cast in elections. If we all got behind one topic, and if we made health care the yes-no topic in every election, the politicians would start paying attention. The power is in our hands if we use it. Shame on us if we don't use it. So the goal of the advertising is very simple: to extend that message, to dramatize the problem, to give you the tools to influence friends and neighbors so that we can show the politicians how upset we are. Now, just to repeat the letter that Marissa sent out today to Trudeau and all the premiers, we are demanding that they bring Canada in line with these other countries before the next election. So it's not a vague, let's make healthcare better, and kind of when you get around to it, we'll be grateful. And it's, why can't we have what Norway has? Why can't we have what Sweden has? Why can't we have what Italy has when we're spending more than they are? You fix it before the next election, or we're going to vote against you. And we will. And my hope is, and I'm being blatant here, and I can say this to you because we're dealing with conservative governments, liberal governments, but we're not picking on a party. I'd love for us to defeat one government. If we can bring down one government on the issue of health care, believe me, they will start noticing this. Believe me. And all we're asking, thank you, and all we're asking is what other countries are already achieving. We're not dreaming up some utopian, impossible dream. We're saying we're already paying. Why can't we have what they have? So with that in mind, with that preamble in mind, let me share with you some of the media messages that the work is in 99% finished. You're going to hear quite finished commercials. We're still tweaking a few little things, but it's substantially ready to go. And I'd ask the control room to start by playing. These are radio commercials based on some of the statistics Marissa alluded to. So let's listen to 3 commercials. You can play them right in a row, folks, in the control room. These are radio commercials ready to go now.
In Tokyo, there are 13.1 hospital beds per 1,000 people.
But in Toronto, there are only 2.5.
Yet Canada spends more on healthcare than Japan.
Fed up? CARP certainly is.
That's why we're calling on Prime Minister Trudeau and all the premiers to publicly commit to bringing our performance in line with other countries.
Before the next election.
Join us.
Add your voice at carp.ca/fixhealthcarenow.
Let them know we're tired of waiting. In Venice, the average wait time for hip replacement surgery is 49 days.
But in Vancouver, it's 180 days.
Yet Canada spends more on healthcare than Italy.
Fed up? CARP certainly is.
That's why we're calling on Prime Minister Trudeau and all the premiers to publicly commit to bringing our performance in line with other countries.
Before the next election.
Join us.
Add your voice at carp.ca/fixhealthcarenow.
Let them know we're tired of waiting. In Edinburgh, 93% of people get in to see a GP within 48 hours.
But in Edmonton, it's 43%.
Yet Canada spends more on healthcare than the UK.
Fed up? CARP certainly is.
That's why we're calling on Prime Minister Trudeau and all the premiers to publicly commit to bringing our performance in line with other countries.
Before the next election.
Join us.
Add your voice at carp.ca/fixhealthcarenow.
Let them know we're tired of waiting.
So that's the radio campaign that we're going to be launching right away. Thank you. And as you can see, the alliteration there, Venice, Vancouver, Edmonton. So we're going to be using cities with the same starting letter as a Canadian city. And we're going to be rolling this out all year. Cologne, Calgary, Warsaw, Winnipeg. So the campaign, I think you can see how it goes. And in print, where this is a giant blow-up of what would be a print ad and a digital ad. And this is going to be a giant roll-up banner at the Vancouver show for those of you who are here. We can turn that around. So we're going to be calling on these, and these are measurable numbers. We're not being unreasonable. How come they can do it and we can't? In Venice, 49 days, Vancouver, 180 days for hip replacement. And we do spend more than Italy as a percentage of GDP. Why can't we have what Italy has? It's time to hold them to account. So we're going to be taking those specifics, peppering away on the radio. These will be digital ads. These will be print ads. These will also be ads that you can run in your local communities. For the CARP chapters, we'll be giving you a whole ad kit where if you already have ads or in community papers or whatnot, or even as posters you can give away at meetings. So those are the specific ones. But in addition, we want to use the power of television, where you can create a much more dramatic impression, let's say, to really bring home the problem very dramatically. This is a little bit symbolically, where we're going to see a number of countries lined up in a waiting room, and let's just see how all that works out. This is a 60-second commercial you're about to see. We're going to do a 30 version of it and maybe a 15 as well, so it can play everywhere. Let's run that TV commercial right now.
Hello. Canada checking in?
Canada? Mm-hmm. Okay, you can have a seat.
Thank you.
UK?
Yes.
You can go in now.
Thank you.
Australia?
Australia? Okay, you can have a seat. Hi there.
Norway.
Okay, you can have a seat.
Netherlands?
Okay, you can have a seat. Australia? You can go in now. Netherlands, you can go in now.
Excuse me? How long do you think I'm going to have to wait?
Who are you again?
Canada.
Canada. Oof. I'd take a seat. You'll be here all night.
Thanks.
Ugh, Canada. Norway? You can go in now.
So I think you can see how we're dramatizing. Incidentally, we shot a number of different reactions by the nurse telling him you'll be here all night. There's one, you're going to be here till tomorrow. You're going to wait. So we got a whole variety where we can keep it fresh. But that problem in some ways Not only does it dramatize the problem, but it also dramatizes the importance of all of us in getting action, because we can either, you notice the Canadian, how Canadian, he says thank you, as they tell him to wait. We can sit here in a docile state and say thank you for whatever crumbs you guys give us. Or we can rise up, get angry, and frankly, threaten with our votes. And where will that take place? Let's look at the website. Here's the website. We keep saying go to carp.ca, fix healthcare now. Here's the website. It exists. And you can see that if you just scroll down a little bit, go down, there's our demand, there's our letter, and just move up to the blue bar a little bit and then click on the add your voice. So you can add your voice to our campaign. All you're saying is, I agree, and here's my voice. Now, in this room, if you just take spouses, cousins, children, people you can reach today, and people watching online, we could easily have 2,000 names in there by this evening without trying real hard. We could go after it. Then we spread it, and then they tell people, and then they tell people. We should be able to show hundreds of thousands. And if we can't, then it means we're saying thank you in that waiting room. It's within our power to get behind it. Also, click on the share your horror story. Turn this way. Sorry? Turn this way so you can hear you. Oh, I'm sorry. Here's the horror stories where there's a space. Just move it down a nudge. You can see that space. You can enter your name and you can enter your story. So we can, again, flood the zone. We're not asking people to make things up because we know there's enough horror stories. So here is the tool that exists as of like right now. So it's not just a question of, I saw the commercial, isn't that great? I like the, and I appreciate it, believe me, don't get me wrong. But it's up to all of us to flood the zone here at carp.ca/fixhealthcarenow. We'll do our part, Marissa, myself, and the team, in dealing with the politicians and making it very clear this is going to be the election issue, if we want it to be, because you and I, we actually control the ballot box. If we can't make it the election issue, then shame on us. It's time to stand up and demand better, and all we're asking for is what other people are already doing. So thank you for your attention. Let's go out and go to carp.ca/fixhealthcare now. Tell your friends, tell your children, your nieces and nephews, your spouses, your neighbors. Let's fill that inbox today. Let's get this off to a great start. We will certainly be keeping you posted on how it's going, and let's get a national dialogue going where we're reinforcing each other and telling them, fix it or face defeat at the ballot box. It's that stark, it's that critical, it's that important. Thank you so much.
So now I'd like to invite up Bill VanGorder, a member of the National Board of Directors, also a volunteer board member and past president of the CARP Nova Scotia chapter.
Thank you very much, and thank you everybody for coming, for watching today. This is the kind of advocacy campaign that Atlantic Canada really needs. Canada's healthcare system does not give us what we need. It deserves a failing grade. It's void of leadership. Well-meaning bureaucrats are constipated by politicians who fail to take leadership. Atlantic Canada suffers by the inaction of our elected representatives. The Atlantic provinces see tens of thousands of taxpayers unable to find family doctors. Lack of access to required medications is making our citizens more sick. Across Atlantic Canada, our provinces are spending more on health by percentage than any other provinces in the country, yet we're getting the lowest results. Hospitals are being closed. Patients are forced to travel quadruple the distance to receive medical care. And wait lists are worse not only than any other province, but longer than comparable countries all around the world. I'm speaking for Atlantic Canada, but I know that across the country, you can all identify with the same kind of problems. The physician shortage is decreasing. There's less and less physicians available. And pharmacare has not been updated in many provinces for over 10 years. Cancer medications for seniors are much more expensive for individuals in our part of the country. High-dose flu vaccine, which should be available to all seniors who are appropriately on the frailty scale, is only available to those in long-term care homes. If we want to keep our people out of long-term care homes and allow them to stay home like they want to, shouldn't they be the first to get the high-dose vaccine they need? Diabetes medications that are appropriate for seniors are not covered even when they're age determinants and their doctors order. I could go on and on. Across the country, it's no exaggeration to say, when it comes to health care, we are mad as hell, and we aren't going to take it anymore. Across the country, we want real action, not talk, not promises, not action. And we want it now, before the next election, and in some of our provinces, that's very close. Before the next election, fix health care now.
And now I'd like to invite up Ramona Kaptyn, a national board member and president of the CARP White Rock South Surrey chapter. Ramona.
Thank you, everyone. I'm originally from Hamilton and Toronto. I moved out to Vancouver. It'll be almost 11 years now. In Ontario, in Toronto, I practically died in hospital twice, once with appendix, once with an ectopic pregnancy. I went out to BC quite by accident, and when I arrived there, I discovered, lo and behold, you couldn't get health care until you were a resident for 3 months, and then you had to pay a premium every month. Well, the Oregon government, the NDP, have changed that, and now you no longer have to pay a premium, so thank goodness for that. But I have other horror stories. When I finally did get a doctor, which is very, very difficult to get out in BC, I wasn't quite retired yet, I still am not, but a lot of retirees do go out to BC, they go to Vancouver Island. Well, try and get a doctor, there just aren't any, so you have to depend on walk-in clinics. What do the walk-in clinics do? They do Botox and all kinds of lovely facial enhancements, so you wait in line for your pain medications. And believe me, that did happen to me. First with, guess what? Hip replacement. I didn't wait 180 days, I waited a year because the doctor didn't believe me. The X-ray wasn't showing what it needed to show. So I went and paid for my own MRI because they wouldn't send me for an MRI. I finally got a friend to refer me to a doctor that she knew who had a look and went, oh my God. And I got in very, very quickly, successful hip replacement, everything is fine. Then, a year or so ago, I was stricken with cancer. When I found out, they send you off to the BC Cancer Clinic. Now, don't misunderstand me. They really take good care of you there, but it takes forever for them to start caring for you. So I'm waiting 2.5 months, wondering, is this going to get worse? What's going to happen? And of course, the pain is horrific, both times with the hip and with the cancer. So you have to make appointments to go and see your doctor. Well, it takes forever to get in, and then you have to beg for pain meds. And I mean, obviously, you're in pain, otherwise, why would you be there? And then they give you little charts. Well, how high is your pain? Is it a 1, a 2, a 3? It's an effing 20. And then you have to keep making an appointment to get more meds because they think you're going to turn into some kind of a drug addict because you need a new hip or you have cancer. So anyway, what is happening in BC is dreadful. So many people go out there to retire. Can you find a GP when you get there? Good luck. There aren't any. Gerontologists, there aren't any. If you're from Toronto, stay here. I don't recommend going out there to retire, even though the weather is much better than it is here today. So waiting times are terrible. Hip replacement, knee replacements in BC are not that hot. The BC Cancer Centre, once you're in, they really do take good care of you, unless the equipment's broken and you're sitting there with a full bladder waiting to have your radiation treatment. But it just is not right. It isn't right. I've lived all over the world. I've lived in England. I've lived in Australia. I've lived in Vietnam. I've even lived in Bangladesh. And there you could get pain medication on every corner if you felt that way inclined. So, as Bill said, we're madder than hell, and we need to do something about it. Thank you very much.
Thank you to all of you guys for coming up here and sharing. And really, I think this campaign compares Canada to other countries internationally, but Bill and Ramona highlighted the deficiencies in parity across Canada. I mean, just in access, which in many ways flies in the face of the Canada Health Act, which was meant to create equity and access in healthcare. So with that, we thought we would open it up to the audience for any comments, for any stories that you'd like to share. We'd love to hear from you.
One sec. Hold on, I'll hold it. Go ahead.
My name is Bob Coffey. I may be the only person still alive in Canada that has worked on 3 royal commissions. I don't disagree with anything you've said, but the way to get politicians to do anything, you have to go in what I call lie with integrity. You have to go and you say, Prime Minister, 4 years ago, you came out with a brilliant idea. He can't remember back 4 years ago. And for the next 5 to 7 minutes, you talk about the wonderful idea, but you never state what it is. Then you state what it is. So your letter is great, but if it said 4 years ago, you thought about a whole lot of these things, then they might do it. So my rule is, on the elected people, if it's not their idea in the first place, no matter what we do, it'll never get done.
You know, one of the issues we have in Canada is we have the feds and and thank you for that comment. You know, our feds and our provinces, they talk past each other. Isn't it odd that most of our we just came through a federal election in Canada last fall and barely any mention of healthcare? The feds don't want to touch it with a 10-foot pole. Right? And the feds and provinces talk past each other. The feds say, well, we give money to the provinces, so it's up to them to administer. Yeah, okay. And then the provinces say, well, if only the feds gave us a little bit more money, we could do better. And what CARP is saying is you guys need to get in a room and you need to figure it out. And one of the things we have been tracking, sir, is we've been looking at promises made by each of the provincial governments, and I promise you we'll be holding them accountable for those provinces. In many ways, the promises that they have made don't even meet the needs of patients in that province. So we'll be holding them accountable, not only from head office, but through our chapters as well.
If I can just add one comment. Part of our campaign going forward, having sent the letter, which is today's event, we're not going to forget about that because their responses we will be promoting and publicizing. And no response is a response. So imagine a headline. I'll pick a name at random. I'm not picking on any premier. 60 days in, still no answer from Jason Kenney is not a headline that Jason Kenney may be excited about. We will be reporting on whether they responded to us or not. We are going to keep up the pressure relentlessly.
My name is Sharon, and one thing we have not mentioned, and it's the largest problem in Canada, and it's mental health. To see a psychiatrist, it takes a year if you could get one, and since psychologists are not covered, the only place you could go is a psychiatrist.
We certainly do identify with that in Atlantic Canada, and that's a good question. We have the highest rates of suicide of men over 65 in Atlantic Canada, and virtually no new money going in to work on that problem. Seniors mental health. We may not have mentioned it this morning. There are so many things on the list, but in Nova Scotia at the moment, there's a specific campaign talking about that issue. From CARP to the politicians and looking for action now.
I'd also like to just add, just this past week, we heard from the Ontario Health Minister, Christine Elliott. She made a commitment to invest $3.5 billion for mental health services. Just to put that into some perspective, our healthcare budget is $60 billion a year. And over the course of 10 years, we'll spend $600 billion on healthcare. Is $3.5 billion enough to invest in mental health? Probably not.
Okay, just hold on one sec.
Yeah, hi. My name's Bob Tchaikovsky. I have an issue basically with dental. Dental is just as important as mental health and full body health. Unfortunately, I need implants. I gag, so I can't basically have, false teeth. Basically, I need implants, and I'm also on Canada Disability, basically CPPD, and I only get $1,075 a month. That's not enough money for anything, basically. They don't understand that the cost of living keeps going up substantially. We need more reform in terms of getting resources to us financially, because, this affects my health, my mental health. Basically, if I don't have money to go out and buy food or put, a roof over my head, I'm just, having health problems, basically, whether they be panic attacks or whatever, and the problem just escalates. So one problem leads to another problem, basically. So I need dental implants, and I need more money. We cannot survive on $1,000 a month. I wrote an email to my MP 3 weeks ago, no response.
So maybe I can comment first, and then you guys can jump in if you feel like speaking. But so you're absolutely right. When we talk about the social determinants of health, financial security is a key determinant in someone's health and safety. The other thing is ensuring access to dental is so critically important. In fact, when we look at other international countries, OECD countries with comparable health systems, one of the things they offer is dental. Because we see so many people ending up in the emergency room every year with dental emergencies. And so they figured that out. And yet our politicians are dragging their feet over here because it's a budget line item. Now in Ontario, Premier Ford announced, I guess last year, that he'd be offering it a dental program for low-income seniors, people over the age of 65. Implants are partially funded. But you need to be over the age of 65, and you'd have to qualify the way.
65, unfortunately, and where am I supposed to get that discrepancy in funds? Basically, if I get $1,000 from Justin Trudeau.
That's right. No, I understand. I understand your pain, sir.
And I do have a copy of the letter I wrote to the MP. I can certainly read it if you have a moment.
You know what, why don't we chat after, and I'd love to.
Certainly, that's why I say basically, if you want Canadians to let them know basically what I wrote, and the no response basically that Rick's just talked about basically. So certainly, Thank you.
Yeah, we absolutely agree with your point and your issue. And we'd also want to point out that lack of dental care in long-term care homes right across the country is a huge problem. The McNally report out of Dalhousie University that just came out showed all the facts and figures, all the horror stories of people whose dental health was not identified and causing problems and eventually death with many of them. Not having dental care available to all seniors, no matter where they are, is just inexcusable and really difficult to understand why anybody would think that we can continue in this country not offering dental care to seniors.
I'm on Canada Pension Disability, and unfortunately, or fortunately, I'm not at 65, so I get a double whammy in my back, unfortunately.
If I may jump in, from research that I've done, if you don't have good dental health, many different things are going to happen to you. The rest of you is going to go. You're going to get sick because of the poisons. And so therefore, if our health system started covering dental care from the time we were small, we would save tons of money on diseases as we age. So it makes good sense to cover dental care.
Canadians and Canada would save money in the long run if we invested initially into our health system.
There are a lot of topics like this, and this is a critical one. But again, I come back to the international comparisons. So it's not like we're grabbing one health topic, hey, let's fix it. It's other countries are already doing this. So we're just going to keep hammering and hammering and hammering. How come they're doing it with less money? We're not doing it with more money. So it all these points coalesce to a failure of the leadership to look at health from a holistic point of view and have a rational plan to deal with it, which other countries have solved. And that's what they have to be accountable for here. Thank you.
Hello to the panel, to everyone in the room and everyone who's watching online today. My name is Karen Cumming. I'm here with my sister Patricia Milne. We are so excited to be here in the room with you all as the authors of a new book that is called The Indispensable Survival Guide to Ontario's Long-Term Care System. And this book was born out of our own mother's experience of the long-term care system last year, and all of the lessons that our family learned that we felt compelled to share with other people across Ontario, across Canada, and around the world. And I'm interested to know what all of you on the panel have to say about the piece of the puzzle that long-term care is in relation to your healthcare advocacy campaign. We know from personal experience that there is huge need and many gaps in the system. People are struggling. People are trying to hang on to their sanity, attempting to navigate a system that they don't understand because no one has taught them how it works. We'd love to hear what you all have to say about that. Thank you.
So I can maybe I'll start. So there are so many challenges in long-term care, and I alluded to some of them in the speech. But we hear stories in long-term care all the time. Just a few weeks ago, there was a woman that was quarantined to her long-term care room infested with bed bugs, and management knew about it. We learned of a woman who died of a UTI in long-term care, a urinary tract infection in long-term care. That is preventable. That should never have happened. That happens because of neglect. We hear about abuse in long-term care where seniors are pushed to the ground or told to feed themselves. We hear these stories all the time, and it is so unacceptable. Isn't it odd that most people in long-term care wake up at 5:30 a.m., but we don't feed them until 7? Or maybe the entertainment will come in at 8 p.m. at night after most people have already gone to bed, or most of the staff are around during the day, but what happens in the evenings? They all go away. It's not a patient-centric model. We haven't invested in the patient in long-term care, and we know that anywhere between 5 to 10% of the population will end up in long-term care, and we just aren't investing in those facilities. And we also need to invest in the support, in the care workers, in the PSWs in those facilities. We pay them the least of any care worker in our system. What is the incentive to become a PSW in this country when you get paid $15 an hour and you have some of the most laborious work I can even imagine?
I'd love to expand on that point. As all of you, I'm sure, are aware, it's common knowledge that there's a severe shortage of PSWs in Ontario. And most people don't know this until they actually find themselves in that situation themselves. The question, if I could sit down in front of the long-term care minister today, would be, what is your plan? It is a system that is crumbling before our very eyes, and there is a tsunami of elderly people who are coming crashing to the shore, and we're not ready for it. What are you doing to attract more young people into this profession? It is no longer a profession of choice because of the low pay, the unreliable hours, and the physical nature of the work. There will be no one but robots to look after us when we get to be 85, 90, 95 years old in long-term care. I'm hoping that might be a piece of your advocacy campaign in the year to come. We have to hold these people accountable for this.
It is a pillar.
Yeah.
It is not just a piece. It is a core pillar of our advocacy campaign.
Let me just add one point. I have dialogued with Karen already. I have a copy of the book, and it's got a lot of invaluable sort of here's how it really works, folks, advice that we intend to promote and disseminate within our own channels. So but there's two parts of the problem. One, there's no strategy except Band-Aids. Quick, some more beds. Maybe that'll shut them up. But the second thing that goes to the heart of the entire healthcare system, not just long-term care, and you put your finger on it, which is navigation. So as bad as it is, it's made worse by the fact that you can't even figure out what it is, as bad as it is. And they could fix that tomorrow. How dare you have a system that with all its deficiencies, you still can't figure out where to go and who to phone and what to do. And I know in the book there's a lot of examples. Go here, click on this, phone this. I mean, it's very unfortunate that these strategies are even necessary. But they are. So this is another place where we are going to put a lot of pressure on. CARP members over the years, we've surveyed them many times, and inability to navigate the system consistently ranks as one of the top problems. I don't know whether that's, I imagine it's true
yes, it is.
East and West.
Yes, in White Rock, Surrey, it seems the government depends on not-for-profit agencies to disseminate this information. So we have a lovely agency called Come Share Society, and whenever a CARP member calls me, I always say, give Come Share a call, because they know where to send you, where to go. I mean, there is 211. There are various numbers that you can call, but unless you're informed, how do you know? Right. And it's so difficult for somebody who doesn't have computer smarts to dig through everything.
And I would only add that once again, it speaks directly to David's points earlier, and that is there are many good examples of countries around the world who treat their seniors in long-term care homes much better than we do. It's not rocket science, and it's not that somebody hasn't done it before. When are the politicians going to make the decisions to tell their bureaucrats, tell their managers that we want them to start copying good practices, start managing their departments, and not try to reinvent the wheel and just give us promises?
I'd like to make one more comment. I think the genius of your approach in all of this is that you are making it an election issue among those of us who are still able to go and vote. I was so disheartened one day to suddenly have the penny drop when I realized that at least part of the reason why the long-term care system is in such shambles is that there are no votes in it for the politicians. If you're 90 years old and you're in a bed, you're not going to be going to vote, which I found heartbreaking when I really realized that was the way it is. So I so believe in everything that you're saying, that it's up to us. We have to hold these people accountable, and we have to use our votes in order to do that.
Yeah, but if you're 90 years old, you may not, but your kids will, and your grandkids will. And so the people that care about you, hello, we can do it.
Thank you.
Thank you. Thanks, Karen. Is this the last one?
Thank you for putting on this session. I think it's very timely, and it's very important for us to have this discussion at this time. I'm Hazel Stewart. I'm a retired dentist. We've been talking about access to dental care for a long, long time. As a dentist, I have stories of people who have tried to take out their own teeth using the mechanic's pliers. As a dentist, I know of a woman in a long-term care who fell out of bed, broke her jaw, and nobody was there to diagnose it, and she was being treated for other things.
Sure.
Because there was no professional there who had the expertise to thoroughly examine her and find out that she had broken her jaw. She was with this broken jaw for months before somebody went in and said, let's check her face, and found out that was her situation. It's time to put the mouth back in the body.
Hear, hear.
She was in pain, but nobody knew it. But it's time to put the mouth back in the body. When we talk about healthcare, we talk about it as if everything else but the mouth matters. And you can never be healthy without a healthy mouth. Why talk about nutrition if people can't eat because they're in pain or they don't have the necessary dentition to be able to eat properly?
Or they don't have the money.
Or they don't have the money to be able to get the teeth they need to eat properly.
Sure, of course. You're here. Thank you.
I think
Put the mouth back in the body.
I think we have time for, okay, well, maybe 2 more comments over here and then, yeah. Okay, we're, all right, okay.
Hi, I'm Hillary. My name is Hillary. My question is, because the governments really aren't doing much to help people who really, really need it, would they ever consider the idea of preventative medicine, even hitting people earlier so that this kind of thing doesn't happen? Would that wake any of the politicians or the governments up to realize preventative is going to save the money if they look at it to say, yes, it would save money, rather than ignoring all these people who desperately need help across this country?
Well, I've had those conversations many times. They're budget line items. That ultimately it comes down to money. Even vaccines, critical vaccines for seniors that are proven to work. The high-dose vaccine, the vaccine that fights against shingles. We fund in Ontario, the Ontario government funds the vaccine that's half as effective as the one that is currently on the market but isn't funded. And seniors have to pay out of pocket for it. Vaccines for pneumonia, for pneumococcal pneumonia, those aren't funded. One is, the other isn't. You know, the government should be investing their money this way, but we spend a fraction of our healthcare dollars on prevention. The majority of our dollars go to hospitals and family physicians, and that is the situation.
Well, there's a young man on one of the talk shows yesterday who's had mental health issues, and he's bound and determined to help other people so that they won't get into the mess that so many of the young people are. He said, I've been there, I'm here to help. Are the politicians not listening to all these people? There are a lot of people out there who really, really want to help those who are less fortunate.
But it also calls, your point is so critical because it calls for a change in the philosophy from a system built for the convenience of the providers and the bureaucrats, and a system that puts the patient, the consumer, if I start with you as the center, and I look at if you're the center and I build around what you need, there's a huge amount of prevention, there's education, there's nutrition, there is acute care, because maybe someday, you break your arm, I'm not wishing on you, or, you get a serious, so the treatment, the hospital, that's part of it. There's management of chronic conditions. There's an entire continuum of service, including prevention. If I was looking at it through your lens or my lens, you'd be factoring all that into the plan. Instead, it's silo, 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 silo. No wonder it's not coordinated. But what you're touching on is asking, which we're going to be doing, flip the system to one that puts the patient at the center and not all the silos.
I think if we really pushed hard enough, and if all of the CARP members got together and really pushed this, someone's going to wake up someday soon if there isn't any money to help the people who need it.
That's what we're trying to do.
It's a fundamental redistribution of the dollars in our healthcare system. We spend $264 billion a year. We need to rethink how we're spending those dollars, not continue to maintain the status quo. Thank you for your comment.
I have a question. I'm recently retired from the practice of nursing. I did 47 years in nursing, and my specialty was geriatric nursing at the University Health Network at Toronto Rehab. So I would like to focus on, we are all recipients of our own health care. I think we should take a proactive stance rather than just a reactive stance. Those members of CARP, I just recently participated yesterday in the 360 Health portal. I've given my input about how to access it easily. I think we need to become members of a lot of committees. We have to really promote changes in the College of Physicians and Surgeons for their limitations of the number of people they assign for specialists. I think we have to get on pharmaceutical companies' list and be asking them to be open about the cost of their drugs. I think we have to be on a lot of boards to really get good quality care. So I think we really need to take a proactive stance, as I said, and get our voice heard. We can't just sit back and say we're here. We do more homework with our RSP and our financial management, but now we have to say what we need to do with the resources that we have. Politicians do not have the background knowledge. We are all specialists in our own profession, and we need to be vocal about this.
Thank you.
Thank you.
And I think just maybe last comment down in the front here.
Maria Michelianis McLaughlin, former president of the Etobicoke chapter. When we first started the chapter 8 years ago and Moses was there, I asked a question about how we are marketing what CARP stands for with young people. My first profession was as an educator, and I think we need to have some changes made in the curriculum so that young people understand there's a future for them to work in the whole field of healthcare, whether it be research or hands-on and so on and so forth, and also develop, like in the medical engineering, some rehab portions. My concern is, as we look at the politicians, we need to ask them a corollary question, and that is, what are you doing to make sure that doctors have standards, that our various hospitals have standards that are unique, and so on? There's a whole area that isn't just called healthcare for long-term care, but to start filling in the middle pieces and being at the foundation with young people.
That's a good point.
Thank you. Okay. So we will continue this discussion out there. Ramona, Bill, David, and I will be out there for further comment. But to conclude today's event, I'd like to invite the president of CARP, Moses Znaimer, to the stage.
Well, I must say I found the discussion in this part of the morning not only interesting, but inspiring, really. And I hope you've noticed that there's an entirely new tone that we're going to take in the year ahead. We've been very well behaved in the past and have proceeded in the normal way to file reports, to visit with politicians, to talk politely with them, and so on. And you can hear now in the presentation that Marissa and David gave that it's a whole new day. Part of my purpose and our purpose in this event today also was to introduce the new team at CARP. I have very high hopes for this new management team. And over the course of the morning, you met Anthony first, and then Terrence and Marissa and David. Where's Jana? Is Jana here? Ah, just outside. in any case, I have high hopes for this team, and as you were able to hear this morning, they really mean business. That was a great and tough address, Marissa, and thank you for it. Two small points, and having launched this morning, it's appropriate that I should bring it to a close. I want you to notice that this meeting is being held in a studio at Znaimer Media Limited. As I've said before, there are 1 million charities, and there'll be 2 million tomorrow. There are 1 million causes, and there'll be 2 million tomorrow. And they all depend on getting their message out, because awareness and education is the solution to everyone's problem. And to achieve that, you need media. You need an ability to speak. And all those other causes and all those other charities depend on some arm's length organization, a newspaper, a television station, a radio station, to pay them a little bit of attention once or twice in the course of a year. They're thrilled. The difference with CARP is it has this alliance with Znaimer Media, and that's what gives us the opportunity to communicate, because we can do that in a room that is wired to the world, that has HD cameras, 5.1 surround sound, and a wire to the internet that is really very different from the kind of resources that any one of your other typical charities can dispose of. The quality of the creative that you saw today was produced at Znaimer Media on behalf of CARP, and that's only part of the story. The next part of the story is the amount of exposure that these messages will receive. In total, we think that there are about 16.2, 16.3 million Zoomers in Canada, and between our television, our radio, our magazine, our websites, and our live events, we touch half of those people every week. 8 million Canadians are reached by Znaimer Media on behalf of CARP every week. And that is a unique combination that I think you should bear in mind. The final thing I want to say is that membership matters. We can militate, we can tick boxes, we can send notes, but the fundamental number that is of most concern to the people that we're trying to address and that we're trying to convince is just how big a gang are we? And if each of you can commit to bringing in just 2 members, if each of our 320,000 members can each bring in 2 members, we'll be at 1 million in no time. 320,000 is a very respectable number, and I think it is probably a larger number than all of the political parties in Canada combined. But imagine what our impact would be if it were 500,000, or if it were 1 million. And to get to that 1 million, all we need is the active engagement of our existing membership, to know that in addition to sending that email, if they could just talk to a neighbor, talk to a relative, bring in a brother, bring in a sister, we would magnify our clout immeasurably. So please take away those messages. Other than that, on your behalf, I'd like to thank the panel very much. We have an outstanding management team and some outstanding board of director members, and we will get a good job done for you in the coming year. Thank you.